Hi, my name's Adam. I'm a final year medical student. Can I check your name?
It's Lewis Potter.
Great. And what's your date of birth, Lewis?
It's the 5th of the 9th, 1988.
Okay. I need to insert a catheter to monitor your urine output. This will involve me inserting a small flexible tube into your penis to reach the bladder. It might be a little bit uncomfortable, but it shouldn't be too painful. I'll insert some local anaesthetic into the penis to make the procedure as comfortable as possible. Have you ever been allergic to local anaesthetic?
No.
Okay. There'll be a member of the nursing staff present throughout to act as a chaperone. Does all of that sound okay?
Yeah, that sounds fine.
Great. I'll just go and get my equipment ready. I'm going to insert some local anaesthetic now. It might sting a little bit, but it should go numb quite quickly. Now I'm going to insert the catheter. Let me know if you feel any pain. Okay, that's the end of the procedure. Thank you very much.
Thank you.
To complete the procedure, I would fill out all relevant documentation, making sure to note urine colour, residual urine volume, and any complications.